Recording. And with that, welcome everyone tonight to this amazing panel. We have our incredible speakers here tonight speaking on the topic of Black and Latinx mental health care. Just the season we've been in, this is a really important conversation to have, and we are so blessed that there are experts in the field here tonight. My name is Sam. I'm with Fontanelli Art, working underneath the CEO of our company, who's here, Christina. And tonight I'll just be moderating, asking questions. But before we start, I just want to say, feel free to turn your camera on. When we get to Q&A, feel free to verbally ask a question. As well, if you have a question that you want to ask, send it anytime throughout the entire discussion tonight. We're going to open up to Q&A closer to 7 and do that up through around 7:30 p.m. Once we start Q&A, feel free, if you have to leave, you can. But the panel will be for about the next hour. As well, if you, just to mention as well, this is a safe space. If you have a question that you don't want to ask verbally, feel free to personally private message me in the chat, and I will ask it on your behalf. As well, if there's questions we can't cover tonight, continue to send them, and in your follow-up email, you'll receive this recording of the session to share with anyone, and also to some additional questions that we didn't get to cover tonight answered. So with that, I want to turn the floor over to our amazing panelists. Christina, would you like to start? Just introduce yourself, tell us about what you do, your company, a little bit of everything, and the perspective that you'll be speaking from this evening.
Yes. Good evening, everyone. My name is Christina Fontanelli. I firsthand am an artist. I identify as Afro-Latina. I'm an art therapist and a dance movement therapist. And I've created a company that just brings art therapy and movement therapy into different communities, neighborhoods. We also do professional development and creating spaces to talk about trauma, and just trying to overcome that stigma. Today, I am delighted to introduce you to two people who are very dear to me, who have contributed their time to be able to talk about a topic that's just so timely. I would like to go ahead and pass it over to Dr. Augustine, if you would like to introduce yourself and the work that you're doing in the community.
Hi everyone, my name is Dr. Dyona. I'm currently based in sunny and sometimes rainy Fort Lauderdale, Florida. It's my pleasure to be here tonight. So of course I wanted to say thank you to Christina, Sam, and Fontanelli Art for actually having me on. Currently my work is mostly doing therapy with adolescents, adults, and sometimes older adults. And I'm actually the co-owner of Augustine and Augustine Psychology with my sister, Dr. Jo. And anything that we can do to improve the community, to teach people about mental health and raise awareness, that's what we're here to do. So thank you so much for having me on.
Thank you so much. And I would also like to introduce you to Jay, a CEO and founder of Kai Wellness in Florida as well. Would you like to introduce yourself?
Hello, everyone. My name is Ulrick Accime, out of sunny South Florida as well. My company is called Kai Wellness Center, and I work primarily with adult males with anxiety and depression, as amongst other issues that kind of come up. And I just absolutely am very happy to be here working with both Christina and Dr. Augustine. To talk to you guys about this very important topic. So thank you for joining us and taking the time out to have a very open discussion, a real discussion about what's really going on in our mental health.
Awesome. Thank you, guys. So for our first question for tonight is going to be, from your perspective and demographic lens, how is therapy and mental health care typically perceived? And what influences that perspective? I'm going to put it in the chat also.
I guess
Dr.
I
Augustine?
can.
Yeah,
Oh,
go
okay.
ahead. Yeah, start
Yeah,
us
no,
off.
what I was going to say is when you ask that question, my background is Caribbean. My family is from Haiti. And when Sam asked that question, the first thing that came to mind is a lot of times when Caribbean people hear of therapy, they think crazy. So there is not a continuum where you can have severe problems and mild problems. It's just crazy, period. So oftentimes what happens is if you're thinking about doing therapy, it's almost like there is a concerted effort from all of the people around you to dissuade you, to encourage you to speak to a religious figure, for example, a pastor, a priest, or a minister, pray the depression, the anxiety away. There's also a sense of shame. So, for example, if you need therapy, you're crazy, you're bringing shame on the family. So I would say those are the main things that I've noticed that will generally dissuade people from seeking therapy, because that is the lens through which a lot of people, specifically Caribbean people, view therapy.
I guess I'll go. So I'm also of Haitian descent, but I was raised in a city in New York, which was kind of low socioeconomic standpoint. And that's where a lot of my work kind of stems from, being involved in public schools and some of the environment that was around me at the time. So even as a young person, I could see that it wasn't people that were angry or just violent or anything like that. It was really more about being misunderstood and being afraid, and certain things coming out, and just generations and generations of um, things going on. So having the space to be able to talk to someone who could relate and speak to in the same language in a sense, and not feel that they had to pretend to be something else or be kind of cornered in any way. And as Dr. Augustine talked about, from where I come from, it's anytime you're seeing a mental health professional, you're crazy, something's wrong with you, you're defective. But in working with a therapist, working with a mental health professional, it's not any of those things at all. We all have mental health. So as much as we have physical health and spiritual health, we also have to pay attention to the mental health aspect as well. So it's about normalizing it. As often as we need to see a medical doctor, we need to see someone who can help us sort out our mental health concerns as well. And even for some of us, seeing a medical doctor, it's hard if we're being honest, and there's some fear that comes with that as well. So you can even imagine on another scale when it comes to mental health. But yeah, that's the lens that I come out of.
Absolutely. And I think something that you spoke on is, normalizing seeking therapy. Uh, and I would like to use an analogy because I also come kind of from a Caribbean. My father was born on an island, but I identify as Latinx. My mom is Colombian, but it's the same thing, shame, guilt. And, I've sat and reflected on why is this stigmatized? And I think it's because it's just normal to struggle. Like, it's normal to have depression. It's normal to have seen trauma. My mother came from a family of 12 siblings. So it was normal for her to not be a child, but to be the adult and taking care and, maybe getting hit, maybe not having enough food. Whatever the struggle was, it was normalized within the family. And I think one of the greatest examples that I've seen in working with people where like the fire starts to come from the family is when they begin to set boundaries, or when they begin to address things in the family, or when they begin to just ask, hey, can we do this differently? Can we not talk about it in this way? Can you not mention that? And I think that's where the battle begins between the family and the person trying to establish healthy boundaries or begin to address their mental health concerns. It's like a fish trying to come up out of the water and just leap into the water when everyone else is like, no, we don't go up there. We stay in the water. This is what we do. Why do you keep going back and forth? That's what I think of. Great question.
I love your responses and how vulnerable they were, also speaking to your own story and background. That's really powerful to hear. I want to talk even more about kind of the umbrella we'll be discussing tonight, which is more of the current emotional health and emotional climate of these different groups in our nation that have been so long disenfranchised by so many systems, with Black Lives Matter movement and the toll that can take on those who are currently fighting in that fight today. And so I just wanted to open up the question. It relates to mental health. So how have you seen this season of emotional vulnerability create a deeper need for therapy and mental health care in Black and Latinx communities? So it's kind of general, but just your thoughts and feelings on that.
I definitely think, going back to what Christina said earlier, a lot of times when it comes to racial issues, marginalization, it has been the normal for so long that now that these issues are coming to the forefront and people are talking about them, it's kind of given a voice to the voiceless. So in many respects, the people who are a part of, Black Lives Matter or movements with regards to Latinx or ensuring that minorities and people of color can get access to therapy, there is a sense that this problem has always existed, but no one really talked about it. Or this problem has become normalized, the dysfunction has become normalized, and now that we're bringing it up, it's kind of like, oh wow, I'm not the only person who has experienced this. So I think that one of the things that these movements have done is they have voiced out loud what a lot of us have personally experienced, but maybe never really talked about or never felt comfortable talking about because we didn't want to be labeled a certain way.
Mm-hmm. I think to add to that, I can speak from just the immigration portion. As a Latinx community member, I had the opportunity to work with children who had just migrated and were experiencing trauma due to family separation at the border. And mind you, this has been happening for years. I am the only one in my family who was born here, and so I don't think that I followed it as closely as I should have. And there's a lot of shame and guilt from that. But in working with that family, I began to have conversations and talk about, like, these families would not come and sacrifice their life for just because they want to come to America to have a vacation. And for me to recognize that even those within the Latinx community may not see eye to eye, which can be the same for the Black Lives Matter movement. I know in particular, my parents were talking about immigrants. Mind you, they were immigrants themselves. And we would have debates and discussions. And I, told them, just because you flew here doesn't make you any better than anyone who maybe took 3 months to travel here. So that gave me perspective that we can't assume that everyone's going to have the same amount of education, the same knowledge, or even the same passion. A lot of people just may not care. And so being able to pick and choose your battles, what you bring up, with whom, and to know, hey, let's just agree to disagree and preserve that energy.
And then from the beginning of the year to where we are right now, dealing with the big C word, right, COVID, having to maybe take things a little bit slower, right? And doing that, really getting away from some of the distractions that were out there and kind of seeing some of the void that the people have been feeling with other things, such as going out, traveling, one job, the next job, relationships, hookups, just being out there, and then being home around some of those individuals that they live with. It's kind of like, oh, there's an issue here. Like, I really thought we were getting along, or these relationships that I thought were important, now that we're not doing some of those other things as distractions, who's really there for me? And this has really made it become a very lonely time for individuals. So where there's a dependence on other things or other people. So that's the kind of work that I kind of see typically in working with adults, is just all the different things that have come in place, and being very vulnerable and raw with some of the things they've covered up. It's like new skin. And it's like, oh, this was there all of this time. So with the Black Lives Matter movement, as you guys both discussed, it's like an issue that's always been there, but you've never been, in some cases, been exposed to it in terms of like seeing it every day, there's always something to be added with social media, the news coverage and everything else, because of anything else that you might have been doing at the time. So it's just like, oh, there's a huge problem sometimes within my own home and to the greater aspect of the world that I live in. And I may need to make some changes with that, learning more about myself and those around me as well.
Yeah. One last thing I'd like to add before we transition is that I think that in this season with COVID and everything that's been happening, unless it hits home, I think that there's just a disconnect, from, people seeing the deaths and the tortures and, Black men and women, children being locked up, families being locked up in cages. Until it hits some home, it doesn't really resonate. And I think that COVID was the example of that. People didn't take it seriously. They thought it was a joke. They thought it was fake until people in their own family or circles began to fall ill. And then there was a level of seriousness because now there's an emotional attachment. Now they're being impacted directly. And I think that that's also the same thing that needs to happen when it comes to immigration, when it comes to Black Lives Matter, is that there just isn't a connection. And that's okay, as long as there's some type of effort or allyship being put in place.
I think the issue of allyship is one that we don't talk about as often as we should. But even when you mentioned, Christina, it didn't really hit home for a lot of people. I think sometimes it's easy to ignore things when it's not on our doorstep. So it's one thing to hear other people, of color, Black, Latin, Asian, whatever it is. It's easy to hear about their struggles with racism, xenophobia, or anything else. And as long as it doesn't directly affect us, it's easy to turn a blind eye. There is a Haitian Creole proverb that says, if your friend's beard catches on fire, you better check to make sure that yours isn't smoking too. And it's a way to remind us that we can't just focus on our own problems. We have to recognize what affects the people around us can affect us too. So allyship is important because we have to recognize you may not speak up for them, but one day it may be you. Better if we all look out for each other as a community.
Yeah, beautiful.
I came up with a question while you all were talking that I didn't tell you about. So I'm going to spring it on you. It's more practical. I feel like even talking about this topic sometimes brings up even just tangible feelings that are maybe triggering or upsetting, maybe even to people who are here tonight. And so I just wanted to open the door to the question of, I know that you guys are therapists, the relationships you have with your clients are unique and cultivated, but if you can think of something, a self-care element or a practical skill that someone can use when there is such a tense or triggering environment around them, what would that be? Just something, maybe a simple one that you know off the top of your head.
First off, unplug from everything, right? Christina's always telling me she takes a day off. She unplugs from all types of social media, all types of outside information. And then from that point, any mindful activity that's important to you. So that can be anything from cooking to meditation to just enjoying your porch or being out in nature. Anything that helps you connect with the present, I think is important during a time where things can be very stressful and overwhelming. And telling yourself everything's going to be okay in this moment, in this present time, and certain mantras that that help you recenter yourself as a person, I think is an important coping skill.
Jay, you kind of took the words right out of my mouth. I was going to say, you do not need to keep up with every news source. It is okay to turn off the TV. It is okay to turn off your notifications for WhatsApp, Facebook, Instagram, or whatever else it is. It is okay to unplug. That's the first main self-care tip that I would give, similarly to Jay. The other thing that I would mention is find your community. So one of the things that I found in communicating with clients over the past few months especially with issues with regards to Black Lives Matter and all of these types of movements. A lot of people were feeling disconnected and isolated. So one of the things that I recommended to my clients is find your community. If there is something that you enjoy doing, maybe it's watching anime or reading manga, or maybe it's a sport, maybe it's a particular TV show, you can find online groups and communities targeted towards that. And in some cases, there are little niche groups that are specifically people of color. So it helps to have other people who look like you, where you guys kind of have a haven from the storm, so to speak. So not to say that you completely disconnect from everybody else, but knowing that you have that safe space and that community can go a long way.
Yes. And to go hand in hand with that, finding the balance between community and being able to sit with yourself. I think that they need to be of equal effort, because I've seen a lot of people go into communities and feel like I'm not being heard, they're not giving me what I need. Whatever it is that they're seeking, validation, affirmation, a voice, a space, but being able to sit with yourself as well, right? Being able to sit with your thoughts and say, I feel this, I'm noticing this, or I'm feeling triggered. And I think really being able to just meditate. And meditate can mean listening to a song. It can be sitting in silence for 30 seconds. It can be saying, I am going to have a great day. That can be meditation. It's just about bringing your mind into stillness for just a few seconds, and also incorporating your breath. Bathrooms are, pre-COVID, are one of my favorite places to take care of myself. Just go into the bathroom for a couple of seconds, wash your hands, make it a tangible, visceral experience. Maybe an essential oil, a perfume, a lotion, something to help you feel grounded. When you're not grounded, you don't think clearly, and we begin to make impulsive decisions. And so to recap, being able to have a community, to feel grounded, disconnect, and just your body will tell you, just like your body tells you when you need to use the bathroom, when you're hungry, when you're tired, your body also tells you what you need mentally and emotionally. It's just about hearing that voice and understanding that conversation better.
I love that. I love that idea of like just sneaking off to the bathroom to like smell your favorite like lotion. I think that's such a good one. I love that so much. And also everything else, very good. And you guys forgot, get a therapist. That's what you guys do.
Yes.
So I want to transition back into that a little bit more, talking about actually seeking tangible mental health care in therapy. And so this question, I think you can choose to answer both or either at the same time. But why do you think that some, either Latinx community, the Black community, or men struggle with searching for help in a therapist? And do you think it has anything to do with shame or pride? I know you mentioned this earlier when you spoke on cultural influences, but if you want to elaborate more on that as well.
Yeah, one thing that comes off the top of my head is, what is most Brown and Black people's first intro to mental health? I think it's the schools, right? So you're having a hard time, you're not paying attention, you might be a little bit impulsive, and here comes this person you don't want to see, but you're being forced to see. And then here comes the medication, and here comes the special classes, and then here comes the, unfortunately, the jail system and all of that, and seeing those professionals over there. So for some people, it seems punitive. It's a punishment kind of thing, and it really relates to some trauma in their lives. When we think of some of those things that I discussed back, when I kind of described the child who was impulsive and not paying attention, some of that is PTSD, right? And some of the places that the child lives in, whether it be the neighborhood or the war zone that's going on in their own homes. And they're from there going to school, and school seeing certain things not being met, and then it again being seen as some sort of punishment. So some people, they're turned off by that. So a lot of the assessments that I do, I'm like, hey, what's your relationship with therapy? 9 times out of 10 for Black and brown folk, it's the schools, and it's like, or a divorce or some type of family separation, and there being some outside intervention. So it brings up certain feelings that aren't very positive. So it's learning and undoing some of that that becomes very difficult for individuals as they grow up. We were having a little private discussion, but again, the shame, the pride comes into play, and stigma comes into play when we think of mental health. Like, something is wrong with you, you are broken, you need to be fixed. It's a moral failing. It's an affront to the family, right? So your mom and dad didn't do something correctly, so therefore this is the way that you turned out. And like a self-loathing for yourself, like, oh man, I can't believe it got to this point where I have to speak to a therapist. And it's not about that at all. You know, but again, you have to kind of get to that bridge. I'll let you guys go, and I'll come back in, but yeah, those are some of the thoughts that kind of jump in out of my mind. Excuse me.
Go ahead, Dr. Augustine.
I definitely think there are a lot of factors that can affect men seeking help. I think socialization plays a major role. So kind of piggybacking off of what Jay said, in our society, we teach our boys, you know, in order to be strong, you can't show weakness. So this is why, starting from an early age, for example, I've seen this, a boy child falls, the parent picks them up and says, don't cry, you're a big boy. Big boys don't cry. So from there, we're already teaching that child, you're not supposed to show weakness. In general, in terms of the socialization, going back all the way to the schools, like Jay mentioned, if you are in therapy, you are in trouble, you are a problem, you are weak, you are defective, you are crazy, you are all of these negative terms. So what happens is it creates an association in your mind, therapy equals bad. So that is already going to be a hindrance to you actually seeking therapy. So what I found is that when I finally get a guy into my office, it's because things have gotten so bad, like they felt like they had absolutely no other choice. So it's not that therapy was a first resort, like a plan A. It was more like plan Z. They tried everything else and nothing worked. Or a family member, either a wife or a spouse, said to them, I really think you need to see someone. But the socialization piece plays a huge role. There's a lot of shame. It affects their sense of masculinity, their pride and their ego. They shouldn't need help. So all of those factors can affect the guy's willingness to seek therapy. And then in addition to that, there can also be cultural factors. So I'm sure Jay is familiar with this. For example, in Haitian culture, what you do reflects on your whole family. So if people find out that you have done something, whether it's, you know, you stole something or whatever else it is, everyone in the neighborhood and community labels your family as being that thing. So that family, it's a family of thieves. Oh, they go to therapy. That family is a family of crazies. So it has an impact that doesn't just affect you, it affects the family. So if you are a person who's family oriented, you shy away from doing anything that could potentially rupture or negatively impact the family. So it's a lot of different factors.
Mm-hmm. So let's take that example of that person shows up, they're past that stigma, they're at that point where they need help, right? And I'm on a personal and professional journey of being 100% authentic and 100% honest. And so I was one of those people fighting my culture, trying to get through. And so I made it to therapy. It was recommended in my first program to get therapy while you're in the program. And I went through 3 therapists, and it just was not working. I felt like I had to explain myself. I couldn't just talk about the situation, but I had to talk about the background of the situation or the Christian aspect or the, Latin culture. And so what I realized, and I share with other people, is that finding a therapist is like a relationship. You have to find the right match.
Yes.
You know, you can't just show up and be like, okay, that's my therapist and we're going to work you know, for X many months or this many years and think that it's going to be great. It's not. That's just the first battle. The second battle is now finding someone that you can connect with, someone that validates you, someone that sees you, and someone that can hear you for what you're saying. And that may take a couple tries. It's scary, it's frustrating, it may be a financial investment, but once you find the right one that helps you just show up as your authentic self, it's worth it. So just allow that grace. That's why there's so many different doctors, so many different lawyers, so many different therapists, because we all have different personalities. And so it's just a matter of finding that one that rightly matches with you.
I think it's so interesting you mentioned that, Christina, because I found that people are quick to switch other types of providers. So if they go to a dentist or a medical doctor they don't like, they are quick to just move on to the next one. But sometimes when it's a therapist, they kind of use it as a, well, I tried, you know, and they just keep it moving. But you are 100% correct. Therapist-client fit is very important. So you can't always assume just because this person is a therapist, just because they look like me, just because they speak the same language, that doesn't necessarily guarantee that you guys will be a good fit. So it is okay to kind of shop around until you find the right person.
Absolutely.
Another thing that just kind of came up to my mind was just the amount of colored therapists available to individuals as well, depending on where you live, right? So some places harder than others. So I have a cousin who lives in Seattle. So you already have an idea of what that might look like for a person like her, trying to find a person who looks like her and providing therapy, which was important to her. So that being a barrier. And then also for us as therapists, I'll speak for my family. My family wasn't doing cartwheels when I was like, hey, I'm going to be a therapist. And like, oh, you're going to be working with crazy people and this is whatever. So there's that barrier too. So if we're able to open doors and show and have representation of this is what a therapist can be, or this is what's available as a choice as in terms of a career for people of color, then there'll be more options and people will be more interested in going about it. And I get so many phone calls like, you're the only Black male therapist I was able to find. I'm like, I know a couple off one hand, right? And I'm not even looking, but I'm in the profession. So I kind of like, oh, if I was a client looking for someone, yeah, there might be some hurdles to kind of go through. And some of those individuals I've met, it's through networking events or Facebook groups made for professionals. So I think also for us, clinicians of people of color, putting ourselves out there and allowing ourselves to be seen is important. And I was seeing, I'll just use this example. I was working with one person, and through the therapeutic process, he's just like, this has really, made me see my purpose. Like, I want to be a therapist. I want to help another person as much as you've helped me. And I'm like, oh, that's great. Make sure you go about it the right way. Don't get a phony certificate or whatever. Go about it the right way, and it's a long journey. And I was real with him, and he kind of took that and he's starting the process. So that was very rewarding and great for me to hear that there's going to be potentially another generation of therapists just go ahead and making it work out. But yeah, those are my additional 2 cents to the question.
I love the practicals that you all mentioned about how there may or will be pushback from those around you in your community, that it's a journey or a process and a decision to implement therapy for your life. And I wanted to throw in another question around this since we're speaking on it now, but just you've given such practicals already, but I'm curious to hear some encouragements from you all. So what is a piece of encouragement that you would give to someone who is seeking therapy but is having trouble finding someone?
I would. Oh, go ahead.
Go ahead. So I would say I spoke up about what I was looking for, not what my problem was. And so I would go into the professional field and say, I'm looking for a therapist who is Latinx, who speaks Spanish, who has a Christian background, who has this, in hopes that someone would share it with their network and share it with theirs. And eventually I found the perfect match. My personal therapist is a dance movement therapist who is Puerto Rican and who speaks Spanish and a Christian. I found me in the therapist, but I wouldn't have if I didn't speak up. It's just like when you're looking for a specialist and a doctor or someone who does that. Just remember to keep your issues confidential, but just share about what is it that you're looking for.
Yeah, I think that's great advice. The only thing I was going to add is, thankfully, I don't know if it's related to all of the different movements out there right now, but there has been a push to create online directories that are specifically geared to certain communities. So, for example, similarly to Jay's cousin, I have had people who have reached out to me to say, you know, I wanted a Black therapist. You were the only one that I found. And in some cases, I haven't even been able to see them for therapy because they don't live in my state. So since I don't have a license in their state, I can't see them. So it's been very difficult for me knowing that they need to be seen but can't find someone that looks like them. So there are different websites out there now. So for example, off the top of my head, there's therapyforblackgirls.com. So that is specifically to find clinicians of color who are female. Same thing goes for therapyforblackmen.org. Same thing. Like, as Christina said, speak up about what it is that you're actually looking for. And chances are you will find that someone either on Instagram or online via Google has created a directory that has those types of people in it. And then, of course, the main website, Psychology Today, you can find all types of mental health professionals there as well.
Yeah. To add on, there's another app, Ayana. I hope I'm pronouncing it correctly. It was recently launched, I want to say 2 months ago, officially out to the public. They had a beta phase, and it's for people of color and for different lifestyles as well. So the marginalized communities as well. So there is a subset within a subset sometimes, and finding a therapist that meets all of the competencies to work with that is important. So Google is your best friend. So people literally Google Black therapists or Latinx therapists, and they're able to find a person. Certain hashtags, right? And Instagram, like I'm looking for a therapist via Instagram, you'd be surprised. Some individuals are just right there, right under your nose, and you may not be using the technology that you have to its full benefit. When you think of social media, I think it really began to help people network and find different things. It's more than different memes and things like that. So finding out if a person has a therapist, right? Hey, would you recommend this therapist? And having dialogue about it and being open with it. So some of my clients will go, I told my friend about you, I hope you have an opening. And sometimes I do, sometimes I don't. So word of mouth, having like that vulnerability, like Christina talked about, like I was looking for this, I opened up, but kept it confidential enough where I'm not spilling my guts out to everyone, but they knew enough like, oh, all right, this person would be a good fit for Christina. Let me pass on the information. So it's the information is out there. So it's just providing yourself enough time to look for that answer. Mm-hmm.
I love all of these things. They're so good. I am also taking notes as well for all of our attendees. And when you get your follow-up email, there'll be you'll have all these clickable links. You can just click around and see and share. I wanted to kind of continue on this kind of a positive turn we've taken in this conversation. When you think about kind of a positive shift in these communities we've been discussing towards therapy and mental health awareness, what was the major thing that played a role in that change? Or if you can speak to maybe how you have used your platform to address just negative stigma around therapy and mental health awareness.
I think for me, it begins with the friends and family that I have around me. It's something that's constantly going on, and I'll speak for my own family. It's like, oh, you need therapy, kind of like a very like a very disrespectful kind of thing to kind of hurt a person's feelings about. And it's just like, no, this is what therapy is. And yeah, you're right to some extent, but don't push the person down and making them seek it out. So that's where I come from a very personal standpoint of normalizing it, making it okay, letting people know of the resources available. For me, being able to go back to my school and have certain discussions with students who are going through certain things and letting them know about some of the services available at their own schools, right? So for many of us who went to college, there was a on-campus kind of counseling center for students, and how many of us made use of it? And thinking back, right, how many of us have seen classmates drop out, or classmates drop out because of mental health issues? But going out there in the community, through the schools, colleges, any open platform that will allow you to come from a mental health aspect has been the way I've been kind of going about making mental health awareness at the forefront in conversations.
I would say that one of the positives that I've noticed is more presentations to kind of provide people with an awareness of what therapy is and what it isn't. So, fact versus fiction, myths versus truths. And one of the things that I've noticed has played a role in that change is when leaders in the community, so for example, it could be religious leaders, for example, a priest, pastor, minister, or a political leader, or whoever it is, actually encourages presentations or symposiums, conferences on therapy, and encourages their members to take advantage of it. So for example, I remember my sister and I, we have our own private practice, and we've had people who have actually asked us, would you be willing to come in and do a presentation on mental health? Or would you be able to do a presentation on depression? What is it? What does it look like? And what started to happen is, by the people at the top normalizing therapy and help seeking, when people actually started to experience stressors or negative events in their lives, they would actually remember what was talked about in the workshops. So for example, I know someone who, her mom passed away, I want to say 6 to 8 months ago, and then a couple of months ago, her son passed away. So it was like she hadn't finished dealing with the first grief, and then another thing happened. And then immediately her husband reached out to my sister and I to say, can you help me find her a therapist? So having leaders in the community, people who, people look up to or they trust, that has been one of the things that has helped lead to a positive shift in terms of seeking therapy.
Absolutely, and that's so good. I think that's really core for people up top, universities, educational institutions, hospitals. I think I do similar work with that as well. I come from the creative arts lens that therapy doesn't just have to be verbal. For some people, that works great, and that's exactly what they need, and they don't need anything else in addition to that. Mostly with kids and youth and teens, it's challenging because they don't know what it is that they're feeling. They can't identify it. And so I come in using what's already in the Black and Brown community: art, food, music, dance, expression, poetry, rap, all of these things, and saying we can use what you already know, and let's make it intentional. Let's go deeper. Let's look at the trauma. Let's look at the emotions, and being able to facilitate that space where it makes it less scary and it makes it more tangible for them, to be able to do it at home, especially with everything that's going on, and kids being in these households with a lot of people going in and out and not being able to have privacy, they have turned to writing or drawing or journaling as an outlet. And so I would say that's how Fontanelli art is really trying to just spearhead and change that conversation of what does therapy look like. It's not a box, it's an experience.
I love all of this. So good. You all have such an amazing way of just sharing what you've experienced and what you want to see happen in this field. And I just wanted to, we're going to do some Q&A in a few minutes. So everyone, if you want to send some questions through, I also have another list that we can continue to pull off of as well. But just to kind of end the panel, the more open format panel session, what is your hope or vision for how mental health care can create lasting positive change in the communities and demographics that you're a part of and that you're passionate about?
That's a very good question. I think for me, what I would like is for people to recognize that just like medical health is important, mental health is just as important, it's equally important. And if we have that in mind, that the two are equally important, it's going to emphasize our need to work on prevention as opposed to curing the problem once it's gotten serious. So in terms of my community, not just the Black community, but also the Caribbean community, I would like it if we could get to a point where mental health is seen as a preventative type of care, where you don't have to wait until you're all the way down here in terms of severity, where you can be at the beginning of either a depressive episode or anxiety or whatever it is, and you actually feel comfortable to go and talk to someone. So I think that the work has started to be done in this area, but there's definitely still a lot that needs to be done. So that's why I love panels like these, because I know that we're all doing our part to make that dream a reality.
I'd like to see schools talk about it a little bit more. So anything from middle school, high school, college, the schools talking about the services available to the students, making it readily available so it's not the last minute, like Dr. Augustine was talking about, like not wait until things really get out of control and you're trying to fix them at that point. I would also like to see it talked about jobs when people are being onboarded with HR, right? So when we think about jobs being related to your mental health, it's anger management or something has happened or some type of disaster that's happened, and they want to help in fixing it. And I don't know what the statistic is off the top of my head, but billions and billions of dollars are lost because of people not taking care of their mental health. A lot of sick days, a lot of sickly FMLA because people aren't taking care of their mental health little by little along the way. People understanding their insurance policies and the insurances speaking to those individuals. So they think medical or dental and come to be surprised like, oh, my insurance covers that? I get to have sessions? Oh, there's nothing out of pocket for this? Or whatever, like it just kind of light up because they don't understand, or the representative or whoever it is that signed it up with health insurance didn't really explain the benefits. So that's the kind of things I would like to see. I really love the commercials that I'm seeing for some of the apps and different things, a different avenue. Hey, let's make it easy for the people. I would like to see more apps that are individualized for subset groups, because that's important. Representation is important. Yeah, I hope that's not too much to ask for, right?
No, not at all. Not at all. I would personally like to see family dynamics begin to change. I do mental health consulting for a daycare for children 0 to 5, and I go in and I observe children's behavior, whether it's tantrum, biting, maybe developmental delays, and I go in and I do consultations with the parents once I do the observations. And what I would like to see is that parents may wear many hats and they forget to wear their own hat of what self-care is. I think that once a lot of families take in, you know, whether it's a family member or a cousin, they forget that they are still an individual. And so simple things is like, you know, taking a shower and eating and remembering to like schedule some time just to do laundry or do anything that makes them happy as a person. I think that parents don't really recognize the impact that they have on the children. Doesn't matter how young the parents are stressed and overwhelmed, the kids pick up on that energy. So I'd love for that self-care to become normalized within the parents and family dynamics.
I love it. I love all the dreaming and vision. And I know that the three of you are such powerhouses in this industry and in this field that it's going to happen. I declare. So I'm really excited for the future, especially that is in your hands. Yeah, it's such what a beautiful conversation so far this evening. We've had a few questions come in. But before we go to more, I guess we're going to just kind of continue the Q&A, just more kind of free flowing here. But is there anything else any of you just like kind of wanted to speak on briefly before I kind of just continue to throw more questions about any of the topics so far?
Yeah, I have something I'd like to add. Within, like, I can speak for the Latinx culture, societal expectations of like, you know, when you're supposed to graduate, what type of career you're supposed to have. I know within the Latin community, like 21, you're supposed to be married, you're supposed to have kids, like what your projected life plan should be. And I've seen nothing but stress and anxiety come from that. And so I would like for people to be mindful of like, not what people say you need to do, but what is your own personal choice? What do you want to do with the life and the opportunities given to you? And to not live for others.
Mm-hmm.
So good. Okay, well, I have more questions. You ready?
Yeah, let's do it.
Lightning round? Well, not really, kind of. Okay, here we go. I'm going to copy paste them in the chat as well as read them. This one came into the chat anonymously. Can you speak on facilitating therapy with youth of color who have experienced racial discrimination, stress, and trauma, knowing that there isn't anything wrong with them, but more of a societal issue?
That's a tough one. That's actually something that I have experience working with, and it wasn't even anything that I did on my own. It was during my internship, but there was a child who had been labeled a problem child, and it was in the dependency system. So child abuse was involved, and they were adamant that this kid needed therapy, and they kept setting him up with therapists, and each of the therapists basically, I don't want to use the word rejected, but they basically rejected, made it seem like as if he was a lost cause, you know, nothing was going to be able to help him. And then they reached out to me specifically because I am a person of color and said, would you be willing to work with this kid? But he has a history of all of these negatives. And I just said, yeah, of course. So I think that one of the things that can help in a case like that is actually therapist-client matching when it comes to things like race, maybe even ethnic background or language, because the reality is those things tie people together. So for example, there have been times where I'm in a group and I'm feeling a little shy and reserved as I usually am. And then I interact with someone and they say, oh, my family's from Haiti. And it's like, what? Really? Oh my gosh. Like it immediately brings you together. So I think in a situation like that, where you're dealing with someone who has been exposed to racism, whether implicit or explicit, who has been exposed to discrimination, prejudice, and so on and so forth, it helps if you can find a therapist who looks like them, who can not just relate, but empathize and understand where they're coming from, and may even have had that experience growing up, because then it gives that client hope that their lives can come out better, even if the beginning chapters weren't so good.
Jay, do you have anything you want to add?
I was thinking of, to kind of piggyback off what Dr. Augustine was saying, some sort of mentorship program as well, really helping build up that person's self-esteem, because you really look at some of the racial injustice, it really takes the human perspective away from you. So it's like about rebuilding some of that as well, and allowing them to kind of see who they are outside of some of the other things outside of their control. Um, I'm trying to think of a child that I was working with who was struggling with the same issue, and it was just normalizing, like, hey, it's not you that's the problem, it's everything else that's kind of the problem, but it doesn't have to remain that way. This is where you can exert your personal sense of control, and this is how you can interact when presented with these challenges, and keeping in mind that you don't have to be any of those things that are kind of projected onto you, which is kind of like a weight that was lifted off that particular person. But those are some of the things that I think of when a person is dealing with some of the societal issues. Is you don't have to fit that narrative that others are putting onto you. You get to write your own story.
Yeah, absolutely. And I think that when it comes to writing the stories, it's also about the perspective. Who's telling the story and who's listening to the story. An example I think of is like a plant, and I felt like, I was traveling and doing art therapy and movement therapy, and it was just patterns of the same thing in completely different parts of the city and the nation. And I'm trying to bring water, and I'm trying to be sunlight, and I'm trying to lift them, but I'm like, something's wrong. And that's when I began to do the work of professional development and training those who are at the forefront, training the teachers, training the staff about trauma and cultural inclusivity. And I think that there's a balance on working front hand, but also being able to be a support and say what you're doing is worsening the situation of the child. We can't fix what the child is going through. We can't fix their history, what family they were born into. But if we can take the roots out and put fresh dirt and give fresh perspective, that can give an opportunity for that child to grow and blossom in the way that they can. I don't believe anyone is broken. I don't believe that just because people have experienced certain traumas, that's the end all be all. I believe that they can definitely overcome if the right people and the right tools are in place.
That's so good. We had another question come in that I really like. I think it's more of like a case by case, I think, for everyone. But if you want to think of some like general, I guess, topics, how to set the atmosphere to do this. But somebody was asking, what recommendations does the panel have when suggesting therapy to a family member or friend?
Yeah. I think of coming out of a place of love and concern, and I think is important. Not coming into it accusing the person or attacking the person with it, not using it as a tool, as we talked about, as a punishment or something negative. I think talking about all of the benefits, if a person can research some of the benefits of therapy and some of the challenges associated with that particular person, to help them see how they can come to the conclusion themselves. Nothing I think people hate more than a choice being made for them or being forced down their throat. It's, I think, important to provide it as an option, like, hey, you've tried just about everything, but have you tried therapy? This is what therapy comes with. These are the pros and the cons of therapy, and here are the resources available to that, so they can really look at, oh, okay, yeah, this does make sense. I can overcome certain things to be able to sit in that seat and get therapy. I've had clients who have been socially, they have social anxiety, and leaving their house to go to an office is a challenge. And when they find out about teletherapy, they're all in. Childcare, oh, that's a barrier. Oh, well, teletherapy. So whatever barriers that there might be, kind of talking to that person about some of those things and potentially helping them come to an answer to their own challenges, I think is a good way to introduce therapy to them.
I definitely think Jay hit, a lot of the same points that I would have made. You definitely want to come from a place of showing support. You don't want to use a recommendation for therapy in a condescending way. So, for example, you guys are having a disagreement, and then you say, you need therapy. That's not the way to go. You want to do it in a way that makes it obvious that you are trying to help. And I also think you can kind of sell the person on therapy by reminding them that this therapist becomes your person. They're nobody else's. They don't have your mom's side, they don't have your dad's side, they don't have your sister, your boyfriend, your girlfriend side. This is your person. They're non-judgmental. You don't have to worry about gossip. So, for example, when you tell family and friends, next thing you know, the whole family, the whole neighborhood knows. But with the therapist, you get one person on your side: cheerleader, encourager, motivator, supporter. They have your back. They're non judgmental. They're not shaming you or guilting you or embarrassing you. Like, there are so many reasons why you would seek a therapist. So when the person is complaining or venting about something, just saying to them, have you ever thought about speaking to someone, can be your way of getting your foot in the door to have that bigger conversation.
I think they answered it very thoroughly. I actually don't have anything to add. I think
Let me add one more thing. Let me add one more thing, right?
Oh,
Christina,
go ahead,
you'll put me on this one, right? I am not your therapist, right? Sometimes that's the opening line, I think, because some people like to go to certain people about certain things, and it's like, well, this is too much, right? And you as a person trying to help, you take it on, and it's just like, all right, well, you're giving me all this, and I haven't really gotten you to where you may need to go. So seeing a professional about this may be the next choice. As much as I do enjoy, wink, wink, listening to what you have to say and venting all of the time, but yeah, this is an option, and exploring it and seeing how it feels. I
Oh no, he froze.
Uh-oh.
It's okay.
We lost you, Jay.
He's here in
Jay,
spirit.
come back.
So, right. I will. So what Jay was referencing was a podcast that I had that's called "I Am Not Your Therapist," and I think that it's important for us to talk about. For me, learning as a therapist, I didn't know I was putting my therapy hat on when I was talking to my friends or talking to my family members. And so for me to be able to set that boundary, and I've asked those around me, if you feel like I'm therapizing you, name it. Tell me. I don't want advice. I just want you to hear me as a human or as a friend. And I think for us to be able to do that in family dynamics and friendships, to be able to say, this is a lot for me to take in. You're not expected to take everyone's pain or burden in, but maybe guiding them to the next place where they can get that extra help. Because then it can get very dangerous very quickly if you are the end-all be-all resource to one person with things that you don't have a background or training in.
Yeah. That's great. I think Jay's going to try to hop back in the long way around. But I wanted to keep going here. We had another question somebody asked, and I'm going to read it verbatim, and then I'm going to give you kind of my reframed question. But they asked, I want to ask how white social workers, counselors, psychologists in schools can help support students of color that have experienced significant stress or trauma from racial discrimination. And I kind of simplified that into what I'm going to throw in the chat here, but how can, we have a lot of mental health providers here with us on the call tonight, but I wanted to frame it this way. How can mental health providers of different racial backgrounds to their clients be the best ally that they can? Or what is an element of effective allyship when you're looking at like client provider?
I think coming at your clients as though they're the experts is important. because in all aspects, right, they're the experts. So you explain to me what that is like for you, educate me, help me understand. And if I offend you in any way, you have the door open to correct me and help me build me as a professional. So they're learning from you and you're learning from them, I think is important. Doing your homework is another aspect. So there's plenty of books out there to help you understand that particular any particular group. I feel, and also speaking to other professionals about it as well. So if you've already established a relationship with the client, I'm not telling you to pull them away from you and put them with another mental health professional. If they feel comfortable with you enough, all right, like let's stay there, right, until the client maybe decide that it isn't a fit. But as long as you're going to be there, maybe having consultations with people of color. And I remember being on another webinar, not just always pulling from those individuals as you need on their time, and maybe even paying them as consultants, right, as experts. To have them on consistently as a retainer. That sounds so gross, but stay with me. They're a partner in helping you get your foot in and understand. You'll never really get it, but you can become better at it. I feel, and there's groups where I might not even get it, and I understand that. But I'm getting better as I go along. So being open, I think, is super important as well. So as long as you come in.
Uh-oh.
And we lost him. So I'm going to jump in with what he said about being open. There's someone, it's a pastor, his name is Pastor Mike Todd, and he has this framework of having a hot church, and honest, open, and transparent. And I think that if we were to be able to apply that to our everyday life and our interactions and to check our own self-bias, we all have them. We all have blind spots. Some things are just not a choice. Some things that are just what we learn in our culture, what we've heard, what we've just been doing our whole life. And I think that the moment someone makes an observation and challenges you or brings something up that's uncomfortable, don't fight it. Just sit with it. Just sit with it and just see, is there any truth to it? Yeah. If there's offense, there may be a little bit of truth. And what do you do with that? I think that's the first basic thing, is just to be able to acknowledge and check yourself.
That's good.
Yeah. I would piggyback off of what you said. I think that when you are a client of a different race, so you are Caucasian or a race that is different from your client, one of the things you want to do is ask questions. And if you and your client don't necessarily see eye to eye on an issue, don't be defensive. Because a lot of times when a client is bringing up a concern, it's not just because they want to offend you or because they want to put you down as a therapist. It's because this is something that is bothering them, and they feel like as their therapist, they should be able to talk to you about it. So I would definitely say ask questions. Don't get defensive if the client says something that either, rubs you the wrong way, or you didn't like the way that they phrased it, or you felt like they were saying something about you and your racial diversity and so on and so forth. And then I would also add that when you're working with a client of a different color, do not make assumptions based on stereotypes. So for example, don't necessarily assume that just because the client is Black or Hispanic or Asian or Indian, then this is the way they are. Don't automatically assume that because a client is Haitian, Jamaican, Chinese, Korean, this is the way they are. You can be part of a specific ethnic and cultural group and not necessarily present like everybody else in that group. So going back to what Jay said, remembering that the client is the expert, asking questions, don't make assumptions, don't get defensive. All of those things will go a long way. And as Josie said, clarification is key. If you're not sure, ask as opposed to making assumptions.
Yes. And two things I want to add to that for the therapist is to have supervision and to get a therapist. I think
Yes.
having those two things can help you be very well balanced, professionally and then personally.
Yes.
I think that is just like it's like exercise for the therapist to be able to constantly work on themselves as they're going through the journey.
That's great. I have a question that came in specifically about school. Jay, are you back with us? I think so.
He seems a
Still
bit
little
lagged.
frozen. I wanted to throw it to
Yeah, it's
him.
lagging.
He mentioned school in his vision dream.
Might be.
Kind of here. Okay, we'll try. So I wanted to throw you this one because you mentioned school was important to you for, but somebody just put in the chat, just curious to know what you think. Did he disappear again? Oh no. All right, well, I'm going to throw it out there before we go robot mode here. I would be curious to know what you think the role of therapists should be in high school and middle school, and what would that look like? So really general, but if you want to speak briefly on this topic.
I think that's a good question. I would say one of the things that I think a therapist to middle and high schoolers should be is an advocate. So for the most part, if it's a person in middle and high school, they are technically a child or a minor, and they are getting pulled in different directions with regards to their parents, teachers, and so on and so forth. So I think that a good therapist in that role, it's not just about counseling and providing therapy services, but it's also about being an advocate. So advocating for the student's needs, because sometimes parents have a specific idea of what they believe the child needs. Teachers have a specific idea of what they believe that the child needs. You as a therapist, though, you get to be a neutral third party. So for me, one of the things that I would say it's important for you to have as a role is advocate.
For me, I would say for the therapist, and I know that like finances and budgets are very, very tight, but to be able to try to come up with some creative alternatives, like what are some different programmings that the school can do? Like an example, yesterday, After School Matters is a program here in Chicago that was an alternative to keep kids out of the streets. And so partnering up with organizations who are willing to donate time or books or supplies, or even bringing in a guest speaker that may be able to touch upon a topic that a lot of the kids may be sharing at the school. And so just really getting creative and getting out of the box of what does help look like. It doesn't always have to be one-on-one. It can be a team effort.
That's awesome. I love that. I'm going to keep going. I've got another question too for you guys. So this one's also somewhat general, and also it could be more specifically addressed as well. But what have you observed to be some common unhealthy coping skills that the Latinx community, the Black community, or men turn to before therapy? It's kind of a big question, but it just maybe based on your, I don't know, experience or clientele.
For me, I would probably say substance use is one that I see a
Say the
lot.
same.
And a lot of times they don't necessarily recognize it. It's more of as you're talking to them in the therapy sessions, you start to notice that certain things come up often. So it could be alcohol, it could be marijuana. And then it's as you kind of talk to them and you kind of start to bring it to their conscious awareness. But a lot of times they don't recognize that that's what it is. So for example, I've had clients who tell me, oh, you know, I just smoke weed specifically because it helps me to relax. And then I'll ask them, what do you need to relax from? At which point they're kind of like, huh, you know, and then they start to talk about stress at their job, stress in their relationships, and all of those different things. And then we start to talk about, okay, you know, you're currently drinking a 6-pack of beer every night when you come home from work. Or you used to smoke, you know, one joint and now you find yourself smoking several. You know, what is the stressor that you are trying to manage? And are there any other coping strategies that we can replace those with so that you can manage your stress, but then also improve your health? Because those two things are intertwined. So that's what I would normally kind of point out to them.
Jay, welcome back.
Hey.
You want to jump in on answering this one?
Yeah, so in terms of poor coping skills, I think relationships is a big one. If you guys haven't discussed that, jumping from one relationship to the next um, is a good one. Substance use, it sounds like you guys were talking about that as well. In being involved in aggressive behavior, impulsive decisions, things of that nature, taking on risk that is unnecessary in general. I think, binge eating or eating disorders, I don't think is something that we talk about enough within the Black and Brown community. Those are some things that come to my mind. So anything that helps with feeling different or forgetting or pushing down becomes important to those individuals, becomes something that they envelop themselves in. So. Mm-hmm.
From the Latinx community, and for this specifically, I'm speaking from my experience of what I've witnessed in my family dynamics, is denial. And so if we look at coping mechanisms, some of them are good, some of them are bad, but it's just about how can I not feel this? How can I change my state of mind, my emotional state, and distract myself from it? And so denial is an effective coping mechanism, but it does have long-term impact, right? And disconnection and trauma and all of that. And so I think that can also, denial may lead a window open for addiction. And for me, I believe that addiction can be anything. It can be substance, it can be, you know, drugs, but it can also be social media. It can be Netflix. It can be isolating, like anything that you're doing for a long period of time that is starting to impact your daily life or daily habits. And so really trying to rework what does addiction look like in a non-traditional sense, because it can be a form of suppression and denial that are hand in hand. And so just seeing where you spend a lot of your time in, and is it impactful? Are you learning about yourself or are you running from yourself? And just having that dialogue.
I would actually like to piggyback off of the denial, a concept that came to mind when you said that, avoidance. Mm-hmm. There are so many people out there, especially men, who their coping skill is avoidance or escape. They just don't deal with it. They ignore it, they brush it under the rug, they just pretend like it doesn't exist. But I always tell people, if you ignore the pink elephant in the room, it'll still cause damage while you're ignoring it. So you have to get into the habit of actually addressing those problems or obstacles as they come up so that you can learn how to overcome it and move past it.
Yeah. Any other questions, Sam?
I was just kind of scrolling through my list. I think we probably touched on almost all of them. Yeah, a lot of them, you guys are so good that you just kind of answered without being asked as well. Good stuff. But I guess I kind of, if anybody has any last minute questions that they want to throw in the chat now, please go ahead. Before that, or I guess during also, we'll give it like 30 seconds here. This has been so amazing. I really have enjoyed this. And I feel like even though I've been here, I'm going to watch it again. Because the whole time,
you know, I'd be curious to hear maybe some takeaways that people are, that like really resonated with them, or like a topic or anything. Maybe if you want to add that to the chat, or if you feel bold and courageous, if you want to unmute yourself and share that with us. You know, we provide what we think the people in the community need, but if there's something that really hit home, we'd love to hear what that was so that we can keep that at the forefront. Thank you, Sam.
Yeah.
I know that what we talked about was heavy, a lot, multifaceted, dimensional.
Come on, adjectives.
Do you want to read the comment that came in?
Yeah, Mike says, I appreciate the fact that you all spoke from your heart.
Mm-hmm.
That's really good. Carrie, I see you come off mute. Would you like to say something with us?
I did. I just want to say thank you so much. I learned a lot. And as a therapist and also a school social worker, I know so many of these things, but hearing it from you is just even better. So one special thing that I'm taking away is that we're hearing a lot of really stressed out school staff and saying, you know, it's really hard to practice self-care when we're caring for so many others, and that we have no time for self-care, and that it's and just hearing you talk about self-care and that you need to be grounded in order to make good decisions and thoughtful choices is just really helpful. So thank you.
We're all in it together, right?
Yeah.
So sweet.
Well, Christina, what do you say? You say therapists need therapists sometimes.
Therapists need therapists, okay?
It's the greatest
Everyone
gift you
needs
can give
support.
to yourself. Yes.
And I know I referenced this earlier about, you know, parents making sure that they're taking care of themselves, but I'd like to open that up for everyone. Every single person right now should be taking at least 30 minutes to themselves every single day. I'm struggling with it, but it's a choice. It's trying to make that choice. And something that's really cool and creative is that even if you just had a jar where you wrote down things you like to do, journal, tea, listen to your favorite song, and you picked out one thing in the morning and one thing at night that you can do that keeps it spontaneous, that keeps it authentic, and it takes it from being like rigid or legalistic. But you're human. You are a whole human and a person who deserves to enjoy and experience life the way you want to.
I love it. Anybody else want to share a takeaway from tonight or anything in the chat? Thanks, Tammy. Tammy says, it was good for my soul. It was amazing.
Oh, good.
I love that, Tammy. It's so good.
Well, I know that we are close to wrapping up. So I would just like to say thank you to every single person who is here with us right now. For those of you who may be watching at a later time, you did not have to be here. You did not have to show up. And so your time is appreciated. And I hope that you got something that fed you. And even after this, take care of yourself. Go listen to what your body's asking. If you need a snack or food or a nap or just to sit down, turn your phone off, no more screen time. We talked about a lot of things that are just maybe very challenging and very true. And so just start right now. Take a moment and just listen. You're doing the best you can given the state of the world that we're in. It's a lot going on. Don't forget, we're still in a pandemic. So have some self-compassion.
It's good. Michelle says, I appreciate the way the speakers address specific issues that affect people of color. Great way forward in doing the work to decolonize mental health and provide socio-education to dismantle the stigma around mental health.
I saw some finger snaps.
Work, Michelle.
Okay. Hey.
That was everything at that one. That was like a thesis.
Save the chat. Save the chat.
I'm saving the chat. That was good. I love it.
Any other final thoughts,
7:30.
Dr. Augustine or Dr. J? I'm speaking
Yeah.
that into existence. Speaking that into existence. Any other final thoughts from our lovely panelists?
Yeah.
I just want to say thank you for having me on. It was my pleasure being here, and I'm glad we got to have this talk because it's definitely much needed.
So good.
I had a great time speaking on some of these topics with you young ladies. It was just an amazing experience to have all of you guys asking some very important questions. And from those questions, even more questions are gonna arise from this, right? So just being very fortunate to be able to be here with you guys. And as you mentioned, we all could be doing something else. We all could, and we were able to make this all happen. That includes you guys who are joining us for this webinar. So thank you from the bottom of my heart for logging in and staying as long as you could. I'm excited to look back at this. This is another bookmark in my journey as a mental health professional. And connecting. I think this is what this mainly was about. Being heard and being seen and connecting with other individuals. We have a long fight ahead of us, right, when it comes to mental health, but we're all in this together, and I'm happy to be doing it with you guys.
Yes. I know I may speak on behalf of the other panelists, but connect with us. Follow us on social media, email us, check out our website, see how we can be a resource to you, or how we can connect you to someone. We'd love to hear more about just who you are, what you do, and what maybe we can talk about in the future. Another panelist discussion. So we appreciate you.
Yes.
All right, everyone.
I was going to add too, have a wonderful evening. Yes. And also the email that you registered with, you'll receive with all the resources that were discussed tonight, all the links for everybody's everything within the next couple of business days, and the recording from this session. So it's all coming to you, I promise. But thanks so much.
All right, everyone. Thank you. Have a great night.